movers in the Tampa Bay area. And we're just glad to have him here at In Touch Radio. He's going to talk to us today about some things that affect our community, specifically the African American community. This man is a VP of Diversity, Public Relations, and Strategic Communications here at Moffitt Cancer Center in Tampa. He is, for full disclosure, he is my fraternity brother, a member of Kappa Alpha Psi Incorporated. And he and his wife Sheila are power couples in the Tampa Bay area. So he's very well known, and like I said, he's a mover and a shaker. So really, without further ado, I'd like to introduce to you and to others, Dr. B. Lee Green, VP Diversity, Moffitt Cancer Center. Dr. Green.
Thank you so much for having me today. I really look forward to the conversation. And thank you for that great introduction. I appreciate it.
Man, my pleasure.
You enough.
Yes, sir. Yes, sir. My pleasure. My pleasure. So I was looking at your bio, man. It's quite impressive. You did some research that focuses on cancer health disparities and minority participation in your research studies. You are also on the Tuskegee Syphilis Legacy Committee. I can imagine that could be quite a committee to be on. Tell me, how is your work? What do you do with that committee? What tell us about that?
So let me start by saying that was probably one of the most significant accomplishments of my entire career. And I would imagine that many of your listeners have heard about the Tuskegee syphilis study, which we now refer to it as the U.S. Public Health Service syphilis study at Tuskegee. The name was changed to put the responsibility of the study on the government and not on Tuskegee University. So the study was done between 1932 and 1972. It was a 40-year study that was really only supposed to last for about 6 months or so. And what they wanted to do was to see what would happen to the human body if syphilis was left untreated. And there were 400 Black men who were part of that study. The purpose of the committee that I was on was to study the impact of the syphilis study on Blacks and other minorities trying to make a decision if they want to participate in clinical trials or research studies. In other words, do people participate or not based on what they have heard about the syphilis study? And that's particularly for Blacks. So we published a number of papers on that topic, and it was great work. But the second part of the agenda for that committee was we wanted to press the White House, particularly President Clinton, to apologize to the men and their families for that government study. And this was back in 1994. And at that time, no president, no government official had ever apologized to the men for that study. And so our committee sent a letter to President Clinton asking that he apologize on behalf of the United States to the men and to their families. He agreed to apologize, as you know, and as a part of that committee, I was invited to the White House to witness that apology. And one of the most amazing things that I have ever witnessed, and last thing I'll say about that, was that when President Clinton said the words, on behalf of the United States, we are sorry, the men and their families openly wept, because you can imagine that weight of them being a part of that study, nobody ever apologizing, was just released as a result of that apology. So great work. I was so pleased to be a part of that historic committee.
Was there any monetary benefit bestowed to those families from having gone through that ordeal?
Yes, there was, Darryl. I don't recall the amount of money that each family received, but they did receive some compensation as a result of their participation in the study. Absolutely.
Wow. You know, studies like that has always affected our community. It took us a long time as a community to even learn that how it has ill affected us. But the Black community is looks at studies like that, and so we have kind of a general distrust for the interest that these kinds of studies have on us. Uh, Tell me, were you able to use your experience with this committee uh, and apply it to what you're doing right now today?
Absolutely. So, one of the things that we do when we, are approaching the community, whether it's African American, Hispanic, white, or whoever, we take the stance of being very open and honest about what they may be feeling about participating in a clinical trial or a research study. We don't dismiss or try to dismiss their concerns. We try to put the concerns on the table and let them know that it's okay to have questions and to be concerned. And we actually recommend that people do their own homework and come to the table with their questions and concerns. But we also let people know that there are safeguards that are in place that were not in place when the syphilis study happened. So
Okay.
we have very strict protocols. We have a what they call an institutional review board or an IRB that is absolutely responsible for making sure that the studies are ethical. And so, if you're going to do research, you're required to also take courses on the ethical conduct of research. And we have to do that each and every year to make sure that we are up to date on the latest and greatest information around doing clinical studies or just research studies in general. There are also very strict reporting responsibilities. So, we have to report out about any of the outcomes of our studies, any issues that may have gone wrong. The other piece that is important for your listeners to understand is that that participants can withdraw from a study at any time without any real reason. If they just want to withdraw, they're tired of participating, they can do that without any penalty. When the syphilis study was happening, they kept those men in the study at all costs. Even men who wanted to get out of the study, they refused to let them out of the study. But that does not happen in research studies today. So, we also think it's important to talk about the great good that comes out of participating in clinical trials and research studies. And many times, clinical trials or those studies may not help you directly, but it may help those patients who are coming after you. So, really, really important for us to participate. Last thing I'll say is that it is important, particularly for Blacks, to participate because we may not know if the drug or the therapy works as effectively on Black patients compared to others. So if we don't have the diversity in these studies or diverse representation, the researchers may not know if these drugs or therapies are as effective in our community compared to other communities. So it's important.
Wow. So, when you talked about processes and protocols, it made me think about OSHA. Is there a regulatory body that governs how you all do your studies? And I heard you talking about doing your white papers and those kinds of things. Who are you turning this information into?
So it is I mentioned the IRB, the Institutional Review Board. So that
Okay.
is the group that oversees all research studies, and this is all across the country. Every institution has to have their studies put before the IRB, and they're the ones that you have to report to if there are any adverse, effects of the study. You
Mm-hmm.
have to make sure you keep up with the people who are participating in the study. So anything that they would require that we need to report to that particular board.
Uh,
So
uh,
it's a
uh, uh,
very critical organization.
is it a private organization or government? All right.
It is connected to the institution itself. So, for example, USF has an IRB, and that IRB
I
works
get you.
directly with the institution. So
Okay.
it's
Okay.
yep, absolutely.
Um. Well, COVID-19. Talk to me. How
Wow.
how are
Yeah.
how are we handling as a community? How's the Bay Area handling the COVID-19?
Yeah, it's really unfortunate that this virus has had a significant toll on the Black community. I think we have all read in in the newspaper, online, the disparity in the deaths from COVID-19 in the Black community compared to other populations. So it has really disproportionately impacted the African American community, and anybody who has been caught off guard by this should not have been caught off guard. And I say that because the reason why we have the disparities in COVID-19 deaths in the Black community is because of the overall disparities that we have in that community. So, Darryl, I'm sure you know, and your listeners know that when we look at heart disease, when we look at obesity, when we look at diabetes, high blood pressure, et cetera, by having these pre-existing conditions, it puts those individuals at a higher risk of having more complications that could, in fact, lead to death. And I mentioned, I probably left out cancer. Cancer is another condition that increases the complications of a COVID-19 patient. And so when we have looked at the data, health disparities in the African American community is higher in all of these areas. And so you would expect that when they present with COVID-19, because those pre-existing conditions are already there, that their outcomes will probably be worse. And so this gives us a great opportunity to really hone in and focus on overall disparities, because if we don't address overall disparities, next year, the year after that, we will continue to see these disparities in COVID-19 deaths, and that's not what we want. So it's time for us to really take the overall health disparities issues, take those seriously, so that we don't find ourselves in this position in the future.
You talked about the different studies that are going on out there, and how African Americans should be a part of that, should volunteer to be parts of those kinds of things. With the vaccine, let's say that it's here in 2021. A lot of people are afraid of vaccines. And what are your thoughts about us receiving the vaccine or either participating in that process?
Yeah. So I see this, the same way I see clinical trials and research studies, that all of us in the community have a responsibility to, participate if it makes sense, if it's for the greater good of our society. And so in order for researchers to, and I'm talking about even before the vaccine is released to the general public, that we're going to need people to step up and, agree to be a part of those clinical trials that will test the effectiveness of the vaccines. So if we don't, and think about this, if we don't have people stepping up to be a part of clinical trials and research studies, there are many drugs and there are many therapies that have been created that would not be created because people were not willing to step up and be a part of that. And so the vaccine for COVID-19 is no different, that we're going to need people to step up and to volunteer to be a part of those studies so that we can test the efficacy of the vaccines. The other thing that we know is before it even reaches a point of being tested by humans, that the researchers have done their due diligence to minimize any risk, any significant risk that may come as a result of being a part of a vaccine study. So just like we talk about studies in general, African Americans should be a part of that narrative, because we want to make sure that those vaccines work in our community as well.
Is Moffitt doing any studies for the vaccine? Are they
So
trying
we
to create?
so I don't know all of the details, but we do have a researcher that is involved in a national study around the vaccine, and this person does a lot of work with the HPV vaccine as well. So nationally known for her work in that area, and I'm pretty sure she's involved in some of the work around COVID-19 as well.
Okay.
Mhm.
Bill and Melinda Gates suggested that we should receive the vaccine, and there have been some really bad information out there when it comes to who's responsible for COVID-19, who it affects, should we wear masks, should we not? there's just a lot of bad things going out there. And since African Americans are disproportionately affected by the COVID 19, and it's really killing us at alarming rates, what is your message, a straight message? To African Americans and Black and Brown people, what can you tell them right now that will instill in them the importance of using all the safeguards that are in place?
Yeah, that's a great point. And unfortunately, a lot of Black and Brown people end up in a lot of those service industry jobs where they may not have the ability to stay home. They may not have the ability to not be around other people just because of the nature of the work that they do. And so obviously that puts them at a much higher risk of developing COVID or putting themselves in a position to get the virus. And because of that, they have to be much more vigilant in terms of protecting themselves as much as they possibly can. This is a new virus, so it's only been around for 4 or 5 months or so. There is still a lot that we are trying to learn about this virus. Still a lot to be determined about this virus. But what we do know at this particular point in time is that you must social distance yourself, and they talk about 6 feet or more, that you should be wearing a mask if you cannot social distance. And what I've been telling folks is that, even if you are 6 feet apart, you still should have your mask on. So just because you have that distance doesn't mean that you automatically take your mask off. And what that does is, your goal is to reduce your risk as much as you possibly can. So if it means wearing a mask and being 6 feet apart, that is absolutely reducing your risk compared to someone who does not have a mask on and they're 6 feet apart. So as much as you can do to reduce your risk, I think is critically important. And we know for sure that those two things, and of course not being in large crowds, obviously, those things absolutely reduce your risk. So if you're in the community and you're thinking about, should I wear a mask or not, you should absolutely wear your mask if you're going to be near individuals, and always try your best to social distance. And if you can stay away from crowds, absolutely stay away from crowds. So I always say, look at the evidence, look at the research evidence, and not on personal opinion, because some of
Right.
this, unfortunately, as we all know, has been politicized.
Yes, it has.
Mhm.
Florida is exploding right now. The cases are exponentially increasing, and um, Moffitt is a cancer center hospital. Are you
Mhm.
all included in the bed count in terms of availability for COVID-19 patients?
That's a great question. I do not believe that Moffitt's our beds are included in that count. Our bed capacity tends to stay pretty full, but that's something I would need to check to make sure of. But Darryl, since we focus on cancer, I would imagine that we are not equipped to take care of COVID-19 patients as a general hospital
Right.
would be equipped. And so we are, what's the word I want to use? We are laser focused on cancer patients. So we would be ill advised to take those beds away from cancer patients for those who may have COVID-19, when in fact there are other institutions in our community who are much better equipped to deal with COVID-19 patients. However, if you are a COVID-19, if you've been diagnosed with COVID-19 and you have cancer,
Hmm.
Moffitt is absolutely the best place that you can come and get your cancer care. So if you have COVID-19 and cancer, we have physicians, nurses who are equipped to take care of you. As a matter of fact, Moffitt is probably one of the safest places you could be, whether you have COVID or not. If you're just a regular cancer patient and you still need to get your care, Moffitt is absolutely one of the safest places you can go to get your cancer care. So we know that when this first started, people were weary about, going and getting their treatment and going and getting screened, et cetera.
Mm-hmm.
That was absolutely understandable. But we now are in a much better position to keep our patients safe, keep our team members safe. And so, the risk of you getting COVID-19 from coming to a Moffitt Cancer Center is very minimal, because we have folks who are experts in making sure that we're doing the best we can to try to bring that risk down to almost zero.
Have you seen an increase in cancer patients coming to Moffitt versus going to the other hospitals because of the increase in the COVID-19 taking up those beds?
So we have not seen an increase in what I would consider those patients who have been diagnosed with COVID and have cancer. We have, seen a pretty steady flow of those patients who are still in need of cancer care. So they've still been coming in. I will say that when this first hit, our patient volumes did go down because, like everybody else, everybody was
Just afraid
trying
to come
to
to the
hunker
hospital.
down and not
Yeah.
go out and do anything.
Right, right.
And so, and we weren't the only institution, here locally or across the country that saw a decline in people coming in to get their cancer care. So we were no different there, but we have now seen the volumes are coming back to what they were pre-COVID, which is a good thing, because what we don't want is people putting off their cancer care. If you're in need of cancer care, we recommend that you come in as soon as you possibly can to get that care. And the same thing with screenings, because as you know, Darryl, it's so important for us to catch that cancer as early as we possibly can.
Yes.
So putting it off 6 months, putting it off a year is not a good strategy. Again, because I reiterate, coming to Moffitt for your care is one of the safest things you could ever do.
Is there cancer that you don't cover?
Great question. I have been at Moffitt for 14 years, and I have never, ever heard anyone say that we don't treat X cancer. As a matter of fact, it tends to be just the opposite, that we treat cancers that other places do not treat because they may be, cancers that are very rare types of cancers. So we're that cancer center that you would come to if you have a cancer that nobody else can treat. So I think we're just in the opposite boat as opposed to cancers we don't treat. We're the ones that treat those cancers that everybody else may not treat.
Wow.
Yep.
Well, I know you've been watching the news, and I know you've been seeing some of the things that have been affecting our community, which is a disproportionate death by the I'm going to say the judicial system. At any rate, um, do Black Lives Matter to you, Doc?
Absolutely. is that a trick question?
No, sir, it is not.
Absolutely.
Okay.
Black lives do matter. And it's interesting that you asked that question that way, because at Moffitt, we have been having the conversation about what's been going on over the past few weeks. And as an organization, we have not shied away from talking about what's going on nationally and locally, et cetera. And, one of the things that comes up from time to time is that, you mentioned Black Lives Matter. Sometimes people will come back and say all lives matter.
Yeah.
And one of the things that I've been able to do is to really help people understand that by saying Black Lives Matter, it is not a divisive statement. When you say Black Lives Matter, it's not divisive at all. We all know that all lives matter. We understand that completely. And the example that I've been using with folks is, so say we're in a community and all of the two-story houses are on fire. The two-story houses are having problems. The two-story houses are crumbling, and we don't know why.
Mm-hmm.
And so the folks who live in those two-story houses are saying, we need to figure this out. What is going on? We can't be living like this. We got to figure it out. Da da da. But all of the people who live in single-story houses begin to say, well, all houses matter. Well, yeah, we understand that, but the houses that are having problems right now are the two-story houses, and
Right.
we need to focus in and try to address what's happening with those houses. And so, by saying Black Lives Matter is not saying that none of the other lives matter. That's not what this is all about. It is about addressing those fundamental issues that have been going on in the Black community for so many years that we have not addressed, and it's time for us to deal with those. So absolutely, Black Lives Matter. There's no question about it. And it's time for us to do some things to address some of those issues.
So one of the hashtags that I used to help promote the show was Black Lives Matter, hashtag Black Lives Matter, but I also used a hashtag that said Moffit cares. Tell me, how does Moffit care?
Wow. So Moffitt cares in a lot of ways. I mean, number one, we have a very strong effort as it relates to diversity and inclusion at Moffitt. We put a lot of resources into addressing those issues that many other institutions may not be willing to address, making sure that we have a workforce that looks like the community, making sure that the patients that we see represent the community, and doing all those things to make sure that when someone walks into the cancer center, they feel like they belong at that cancer center.
Okay.
And we have won national awards. We've gotten national recognitions for our diversity and inclusion work at Moffitt. So we absolutely care about Black and Brown communities. We care about every individual in the community. We have programs that address the LGBTQ community because our business, Darryl, is cancer,
Mm-hmm.
and we don't care what you look like. We don't care how much money you make. We don't care what neighborhood you you live in. We don't care who you love. We don't care what God you serve. What we care about is that when you walk in that door, you're going to get the best cancer treatment that you can get. And so by putting all those other things aside, we want to focus on you and your cancer. And so absolutely we care, and we care about everybody who step foot inside that cancer center. No question about it.
Moffat has a big influence here in the Bay Area. Quite frankly, they have a big influence in the state of Florida. I don't know how far they reach beyond that, but Moffat really, well, I'm sure they're a national, international recognition for Moffat. But on a local level, do you see or do you believe that Moffat should have cancer hospitals within the African American community?
So, you know, so one of the things that we do know is that people come from all over the world to be treated at Moffitt, all
Okay.
over the world. I want to say that over 133 different countries. We have seen people from 133 countries, I believe is the number. We see people from every state across the country, every state, all 50 states. We have seen patients from every county in the state of Florida.
Mm-hmm.
And my message here is that people come from all over to come to the Moffitt Cancer Center. Um, to put facilities in the Black community. I'm not sure if we have even had conversations about that because we try to be very strategic about where we put our facilities and locations, with the hope that where we do put them, that they are accessible to the Black community, the Brown community, or whoever
Mm-hmm.
need their cancer care. We have made announcements that we will be opening up a facility in Wesley Chapel. We're opening that facility because we know that there is an increase influx of residents who are
Yes,
moving in that area.
true.
And so we want to make sure that we have a presence there. We already have the location out near International Mall for that part of, the Tampa Bay community. And the other strategic reason why we put it there was, I mean, it's what, 10 minutes from the airport. And so those folks who are coming from other parts of the world, other parts of the country can land, go right there to that facility, get their treatment, and get right back on a plane and go back to where they
And it's
came from.
accessible from St. Petersburg as well.
And that's the other,
Yeah.
yep, is
Yeah.
it's right there across the bridge. So
But
they
let me
don't have
tell
to
you,
come
Doc,
all the way in.
Doc, the reason
Mhm.
I brought that question up is because I see the sprawl that's happening with Moffitt. I look, they're building something over here, they're building something over here, and there may not all be hospitals, but there's some kind of a connection with Moffitt. It's the Moffitt brand, and so it's always boom right there in your face. It's a great brand to have. So it would be good to see that brand within the African American community. Uh,
Yep, yep.
uh, so, Doc, we talked about the COVID-19. We talked about your experience in the past. Tell me about the health disparities that you see in the African American community, and how can you, as a spokesperson for, no, spokesperson is not the right word. Just as an African American, how can you talk to us, to us about how we can minimize or decrease the possibility of attracting the different cancers that affect our community the most?
Yeah, that is a great question. I'm glad you asked that. So, number one, and I've mentioned this before, is that we have to try our best to catch a cancer as early as we possibly can. So,
Mm-hmm.
early detection is critical. One of the reasons why we have a difference in outcomes with African Americans and we have such a disparity is that we tend to catch cancers at a later stage. One example I will give you is with breast cancer. So, white women have a higher incidence of breast cancer compared to Black women. But when it comes to death, it flip flops. Black women die at a higher rate from breast cancer compared to white women. And so, in most cases, if there's a higher incidence in a particular population, the death rate is probably going to be higher.
Mm-hmm.
It just makes sense.
Right.
But in this particular case, it flip flops, and it flip flops because Black women tend to present at a later stage with their breast cancer compared to white women. So even though white women get breast cancer at a higher rate, they don't die at a higher rate when we compare them to Black women. And so it is so important for us as a community to get those screenings, whether it's mammogram, prostate screenings, lung screenings, colorectal screenings. We have to understand, based on our age, when it is best for us as an individual to have those exams. And so a part of that is having a relationship with our primary care physician, so that he or she have a relationship with us so that they can tell us, based on our history, based on our age, based on our health condition, when is best for us to go out and have those screening exams. Now, there are recommendations that are published out there,
Mm-hmm.
and certainly we need to be following those recommendations. But if we have a relationship with our physician, he or she can make sure that based on who we are as an individual, it might be right for us to go and have a screening. The example that I'll use here is with prostate cancer. If you go based on the national screening guidelines, they may tell me as a Black man that I don't have to go until I am, 50 years old. Well, based on my family history, I may need to go at an earlier age than what is recommended for most men. And if I'm having that conversation with my physician, he or she knows me well. They know my family history. They can then tell me, Lee, you need to go and have your screening at a much earlier rate compared to what the national guidelines are telling us. And so that's number one, is making sure that we do early detection. Number two is that we have to control our health behaviors. Like, for example, not smoking. If you smoke, you should stop right now. Try your best to go into a smoking cessation program and not smoke. Watch your diet. We know that having a high fat diet increases your risk of cancer. Making sure that you put on, sunscreen and stay out of the sun. And I know there are people who are saying, well, I'm dark skinned, I don't have to worry about that. African Americans also develop melanoma, and people may not know that.
Mm-hmm.
And so making sure that they, do those protective behaviors to reduce their risk there as well. Exercise. We do know that exercise has an impact in terms of lowering your risk as well. So all of those things as a community, we need to be thinking about what are those behaviors that I can change that will lower my risk of getting cancer. And I'll end by saying that one of the things that we're proud of is that we have a community outreach program at Moffitt. So we have people who are out in the community every single day. And it's different now, obviously, because of COVID-19, pardon me, but they are out there talking to people each and every day about lowering their risk of cancer. Pardon me, because we know that early detection is absolutely the key.
Okay. So in one sentence, who is Dr. Green?
Wow, that's a tough question. The best way I'll put that is he is a nice guy who loves God, loves his family, loves his job at Moffit, who wants to make a difference in society. I think that summarizes it.
That was pretty good. That was pretty good. So listen, Doc. I heard that I heard that the reason you got the job at Moffit was your name is Dr. B. Lee Green, and Moffit is H. Lee Moffit Cancer Center, and so I think it was the Lees that kind of got you in the door. Was that what happened?
That's the story that I've heard. So I'll take it. And whatever it took to get me here, I will accept.
You're glad
it
to
because,
be there.
It is a great organization.
How long you been with them, Doc?
I've been at Moffit 14 years.
Okay.
14 years. And just great people. The culture there is fantastic. The care that we provide to cancer patients and their families is top notch. As you know, we have been recognized as one of the top 10 cancer hospitals in the country,
Mm-hmm.
And we've had that distinction for many years, and it's right here in our back door. And so, I'm very pleased when we have an opportunity to come on programs like yours and really spread the message that we have a great institution in the Tampa Bay community. And our hats off to Mr. H. Lee Moffit, who had the fortitude, the guts, the vision to create this cancer center, because there have been, thousands of lives that have been saved as a result of this cancer center being in Tampa. And so we are fortunate as a community to have it right here, right in our back door.
Well, there you have it. From Dr. B. Lee Green, VP of Diversity, Inclusion, and Strategic Communications. Doc, we're glad to have you on. Thank you so much. We want you to come back and talk more about Moffit and COVID-19 and Black Lives Matter and whatever else it is that you want to discuss. We enjoyed having you here. We sincerely appreciate your honesty. And again, we look forward to getting you back. Thank
Wonderful.
you all for joining us here at Issues and Answers. We will see you next Tuesday, 2 o'clock, right here on In Touch Radio. Be blessed.
Thank you so much. Thank you.